Good afternoon. Thank you for joining us on another Tuesday for a briefing with the Senate Republicans as we share the priorities that we have for this session. And today we're going to talk about substance abuse and the ways that we believe we should be looking at tackling that here in the state of Maine. First, it's a devastation that has impacted every single family, and for that, each one of us feels it so deeply as we look at the policy ways to combat this. We do so recognizing the pain that's behind this issue for so many Mainers. We believe there should be a three-prong approach, that it's treatment, it's prevention, and it's enforcement. Recently, Senator Farron had a bill in front of the Criminal Justice Public Safety Committee, and Senator Farron will be sharing more about that in our press conference here. It was LD 986, and I want to read for you what the Sheriff's Association put out in support of that bill. They said the war on drugs in 2023 is significantly different than it was even 10 years ago, before any of us had heard about the drug fentanyl. Decision makers need to understand that this drug is 100 times more potent than morphine and 50 times more potent than heroin, and it's here, it's in Maine. It's killing the very people everyone in this room is tasked to protect. A recent bust in Portland resulted in a seizure of enough fentanyl that law enforcement said it was enough to kill the entire population of Portland. Since 2017, fatal overdoses in Maine have risen by more than 71%, mostly due to fentanyl. Prevention is more important now than it has ever been. And I am going to turn this over now to Senator Libby, who's going to talk a bit about the education piece when it comes to substance abuse. Thank you.
Great. Thank you, Senator Keim. I appreciate that. Why don't we start with this? Raise your hand if you don't think that education is going to be part of the solution to our drug problem in Maine. Raise your hand. So we all agree. That's great, because we need to agree on that. That is the number one priority of the Senate Republicans behind me. They know that education is a big key. Now, one of the problems that we've had in recent years is that we have had in the past, I think, very effective education in the schools, and it has gone away. And you all recognize it. It's the DARE program. The DARE program was phased out in 2010. There were some, what I thought were very objectionable studies funded by from biased quarters, frankly, that tried to poke holes in a great program. And think about, what it stands for. We're here talking about prevention. We're here talking about treatment. We're here talking about enforcement. And especially with the enforcement aspect, a lot of that has been put on the back burner. And for citizens in this country, not just Maine, there has to be an understanding of A, what can we do to treat the problem? B, what can we do to stand up and prevent our friends from taking drugs and overdosing and so forth? What are the prevention measures that we can take? That requires education. So for me, that also includes what are the enforcement mechanisms and are there any consequences? And those are the parts that, again, speaking from somebody that was here 2 decades ago, those parts of education seem to have taken a back seat. And we'd like to see some of that come back. Part of it I blame on the GAO report from 2003. The GAO report and a few other studies looked at drug use and talked about the fact that we weren't doing enough. Well, we're never doing enough. We're never doing enough to do something about our drug problem in this country. I think what it did was it informed people that we needed to do more, but it misinformed people reports like the GAO report misinform people about how should we go about doing it. Because the how turned into, all right, we're going to push this program to the side and we're going to bring in something else. And that just has not worked. So frankly, it was a great program. I'm going to read you the mission. The mission of DARE, and this could be a mission of any new program, and I think we'd all agree on the components of it. The mission of DARE was teaching students good decision-making skills to help them lead safe and healthy lives. And then the second part, the mission and the vision. The vision was a world in which students are empowered to respect others and to choose to lead lives free from violence, substance use, and other dangerous behaviors. We don't have to rewrite the goals. They're right there. That mission and vision is exactly what we need to think about. And programs that we've introduced, like Senator Farron's bill he's going to talk about, really get to the heart of the heartbreaking problem that we have with drug abuse. So today, here's the issue. Today, our drug problem is unparalleled. We have never had this level of overdoses. We've never had this level of deaths from drug abuse, and we need to prove that programs like DARE did work, and we need to take similar solutions and bring some of that the thought behind those programs back to Maine and really make a difference. And that's what I have to say to you today. And yes, Senator.
Thank you. Thank you, Senator Libby. And education is so very, very important. When we start, as the Senate lead in HHS, and we start looking at the statistics even further, Maine experienced 716 fatal overdoses in 2022. That's a 13% jump from 631 in 2021. Nearly 100 of those overdose deaths have already been confirmed or suspected so far this year. With January and February already running higher compared to last year for both fatal and total overdoses, 2023 may be the deadliest year yet. Of the 56 confirmed drug death cases so far in 2023, non-pharmaceutical fentanyl was the most frequent cause of death for 43 or 77% of the victims themselves. So these are numbers and stats that we continue to look at in HHS, and we talk and hear so much about harm reduction, harm reduction, harm reduction. Well, part of that harm reduction is that we have got to find the resources to be able to help these folks recover from this demon that is living their lives or is within their bodies, within their lives. And one of the things that we're looking at is the efforts of DHHS and HHS to staff and locate recovery beds throughout the state. So often in testimony we heard yesterday related to the vaccines, we have wards of beds that are sitting there open with no staff to staff them. And the majority of the reason we feel very strongly about is the mandate requiring the COVID-19 vaccine. So many of our healthcare workers, they walked away from their jobs, their career jobs, because they could not, in their hearts, take a vaccine that had not been on the market for that length of time. So again, that's a shortage that we are faced with for recovery beds. We also know that we have to work hard to provide the resources necessary in whatever it takes to make sure that we have it. Whether it be working with our school-based health centers, which we are supporting expanding the school-based health centers, whether it's giving our guidance counselors the tools that they need to counsel with the children, to be able to know how to identify overdoses. Again, that was some legislation that we passed. We turned it over to the Department of Education, said we need you to teach our schools, our teachers, our guidance counselors, and what to do and how to identify it and how they can help. Yet the curriculum has not gone out there yet. So again, there's a lot of different things that we really do need to do, and we need to help to get that prevention in place so that we can begin to recover from situations that we're faced with here in the state of Maine. So at this time, I'm going to turn it over to Senator Fair.
Thank you, Mary Ann.
You're welcome.
Hello, folks. My name is Brad Fair, and I represent Senate District 3 and live in Norridge Walk. And you've heard some of the comments going to make, but 716 Mainers we lost last year. Over 10,000 overdoses in 2022. And as many of you know, one of them was my daughter Haley on the 27th of July. And I've had some folks say, well, why did it take that for you to get involved in this? And I'm going to tell you, it's a sensitive subject because as parents, loved ones, you bury your head in the sand with some things. But this epidemic touches from northern Maine to southern Maine to the coast to the mountains. No social economic boundaries, no age boundaries. It's touching everybody in the state of Maine. So I had a three-pronged approach, the old three-legged stool. And you've heard about the education piece, the prevention piece, and then, the recovery piece. We passed some laws. We've done that on the education, but we don't follow through on it. My grandson just turned 14 on Saturday, and during Halloween, when the different colored fentanyl was out, we said, "Is anyone talking to you about this in school?" And they weren't. That's a program like Senator Libby talked about, the DARE program would talk about with our kids in school. One of the big journeys that's been difficult on this is the recovery community. Everything from, you heard about the bed space, to free drug zones and needle exchanges, to medical-induced treatment. There's no agreement. Everybody's all over the place on how to do this. And it's turned my head around. And then on the enforcement piece, we reached out to the sheriff's folks, and we put forward a bill to increase the level of penalties from Class B to Class A, and to make a provision to be able to track using communication devices, because that's how some of these dealers are dealing with this. Make no mistake, fentanyl is not a drug. It is a poison. If it was arsenic or anything else we was doing, this fentanyl, all it takes is a few grains to kill our youth. It's not anything that we can wrap our heads around as we're having these discussions. And we've got to. So in criminal justice yesterday that Senator Harrington sets on, we was having a work session on it, and I could kind of see where there's some folks in the recovery community were stressing that 50 years of the war on drugs and you can't enforce your way out of this. And luckily I got the opportunity to address the committee, and I said we all got to step outside of our comfort zones. I've had to on the treatment piece. Things that I didn't have my mind totally open to, I've got to be part of that solution. And folks that think that their way is the only way, there is not a silver bullet that's going to take us out of this epidemic. We have got to, D's, R's, whatever you are, we have to step outside and do this, or it's going to continue to grow. 716 Mainers, folks. We're not doing our job here. The governor's not doing her job. During the pandemic, right? What do we have? You folks in the press, every day. How many open beds? How many people were vaccinated? How many people tested positive? We sent our children home from school. We closed our businesses down. And we're losing 2 Mainers a day, and no one's talking about it. Shame on all of us as a society. And we got to do a better job. So, thank you.
Thank you, Senator Farron, for sharing your story, and I know that it highlights really the pain that so many Mainers go through as we struggle with this epidemic. So Maine has made record investments in harm reduction, but prevention and enforcement really have taken a backseat, and we need to make sure that Maine is really focused on all three. So with that, I want to take any questions that you may have for anyone up here. And first we'll start with just this topic, and then we can of course take questions on other things if you have any.
Maybe Senator Farron, can you kind of share, obviously it's personal for you, can you share what you hope or wish would have happened in your situation?
I'm not sure I can give you the answer that you're looking for on that. What I'll tell you is I love talking about Haley. She was a graduate of UNE with a major in medical biology and a minor in psychology, and had just graduated with her accounting degree. Worked the day before. We knew that she was traveling in some circles that weren't the best. but no idea, I mean, we lost her in a matter of 3 months. I mean, that's how quickly this fentanyl, you can't wrap your head around it. If you haven't had the experience of how quickly it digs in. And I do think the recovery people got to have options if they're struggling to be able to have that. I just don't want any other family to feel this pain. And if we can save one, and that's one of the comments made in criminal justice, I'd rather have a loved one locked up with stiffer penalties than visiting a gravesite. And that's one of the things we got to do. So one child at a time. And I talked to, Haley's mom, and we say, what would Haley want us to do? And it's like, if we can save one child, one person, one adult, whatever, then it's the effort. But we all have to do better. So I know that's a roundabout way of answering your question, but that's about the best I can do.
Okay. How old was Haley?
Haley was 26. Haley was 26. Yep, absolutely.
Thank you for sharing.
Yeah, I think when he brings that up, I mean, fentanyl, it doesn't give you time a lot often for treatment. It acts so quickly, and that's why prevention has to be key in what we're doing and enforcement. I mean, increasing penalties for drug trafficking, why wouldn't we, right? Why wouldn't we? Any other questions?
Can I go off topic?
Yeah, we can go off topic, yeah.
Okay. So I just got a FOIA request in regards to the Attorney General's relationship that was in the news. And something that stuck out to me, and I'm hoping you guys can comment on this, is that there was no documentation as far as the findings of Deputy Attorney General Todd's investigation into the situation. What do you have to say to the fact that there is no documentation of this internal investigation?
Yeah, so you said it was, and it was an internal review, and so subject only to what they have for protocols in their department. And I believe that's why the presiding officers have gotten an outside agency to do a review of the Attorney General's office. I think that is probably an appropriate response.
That's all I have today.
All right, thank you all so much.
Have a great day.
Thank you.
folks.